everybody, it's Professor Kat. Let's start answering some of your COVID questions. Last week, we saw a spike in the number of cases among students, especially those living in the Santa Clara neighborhood off campus. There's a 10% positivity rate in our testing center on campus, and these high case numbers really reflect the high levels of transmission in Santa Clara County. So it's a good reminder that we can all do our part to get case numbers down so we can get back to normal as soon as possible. Even if you're not worried about yourself, if you think you'll be okay if you get infected, it's important to try to reduce the spread of this virus. What happens in the SCU bubble affects the wider community. If you're infected, whether you're aware of it or not, you might pass it to somebody else and continue that chain of infection until somebody gets really sick. So even if you're confident that you can protect your parents and your grandparents, you might be standing in line at the grocery store next to someone else's grandmother. So it's really important we do our part to protect the whole community. We've gotten a lot of questions about the on-campus testing, so I want to answer a few of those here. We're using saliva samples instead of nasal swabs for a few reasons. Saliva sampling is painless, it's self-administered, it's easy, and it doesn't require supervision from healthcare personnel. Saliva sampling uses the same PCR approach as the nasal swabs, and accuracy is pretty similar. So the saliva tests that we're using have a sensitivity of 89%. That means that 89% of all cases are identified through this test, 11% will be false negatives, and a specificity of 99%, which means that there'll be a very small false positive rate. Early infections, both for saliva sampling and nasal swabs, can sometimes result in false negatives. It may be too early in the infection to have a high enough viral load for the test to pick it up, so just because you test negative doesn't necessarily mean that you are free of infection. The false positive rate for saliva tests is very low, it's less than 1%, but with the number of tests that we're running on campus every week, sometimes false positives will occur. If you're worried that your test isn't accurate, please come back and get another test as soon as possible. And in the meantime, if you test positive, you should absolutely act as though you are infected and isolate. Saliva tests are much more accurate than rapid antigen tests. They're much better at picking up the virus. They have higher sensitivity. Especially if you're asymptomatic, but you're infected, rapid antigen tests are likely to give you a false negative. Among asymptomatic people, studies have shown that rapid antigen tests give false negatives more than 50% of the time. That's a pretty high false negative rate. If you have a rejected or invalid sample, please come back and get tested again as soon as possible. Rejected samples can happen for a variety of reasons. Remember not to eat or drink anything for an hour before the test. And if you've just woken up, have water and wait a bit before you come to the test. It can be hard to generate enough saliva if you've just woken up. There have been some issues in getting test results back as quickly as we'd hoped. We understand that getting results quickly is key to limiting transmission and preventing further spread of the virus. And we're working really closely with the lab to resolve the issues. Labs all over have been inundated with requests for testing at this point in the pandemic, and capacity is increasing quickly to try to meet that demand. The testing centers are set up to minimize the risk both to those being tested and to the staff at the centers. There is good ventilation, we keep the doors open, there's social distancing, and we're opening a second testing center this week to further reduce density. If you are a student who has tested positive for COVID and you need medical care, please call the Cowell Center. You can call them for any other medical needs as well, but they're your go-to stop for COVID-related medical care. We've gotten a lot of questions about campus reopening and the timeline for that, and to be honest, it's entirely dependent on state and local health orders. Cases have started to stabilize in Santa Clara County, so we're hopeful that we'll be able to gradually begin the reopening process soon. But in the meantime, our best option is to try to get cases down to speed that process up and get us back to life on campus.